emphasis on fasting. So there are times where a person can't fast. So today's talk is linked to the fast itself, and I'll touch upon a few things about fasting and then go straight to the issue of what happens if a person cannot fast due to ill health. And there are a lot of different scenarios. People always ask, Mufti Sahab, what shall we do if, for example, a person's asthmatic and they want to use inhaler, if they want to use eardrops, they want to use eye drops, or they want to have maybe give blood, or other scenarios as well. Diabetes obviously is a big issue in the community. So these are things all related to illness. And when it comes to illness, Ibrahim alayhi salam mentions an amazing statement in the Quran where he says, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِ, that when I become ill, Allah is the one who gives the shifa, gives the cure. The ulama mentioned that the beauty of that point of Ibrahim alayhi salam is not a question of if I become ill, but rather when I become ill. That you can't escape illness. It's part of life. And we know the Prophet of Allah sallallahu alayhi wasallam, he would have cupping done, he would use honey as well, which are known to help, cure for certain ailments. And then he would advise certain herbal remedies as well. So these are things indicating that ill health is part and parcel of life. And likewise, when we come to the month of fasting, we don't want to do anything which may either cause us to get ill, or if we're already ill, make the illness worse. So I was just speaking to Dr. Saf prior to our presentation now, that these are things which people need advice on, because it's well understood that Islam has made fasting prescribed. So the verse on the screen, كُتِبَ عَلَيْكُمُ الصِّيَامُ, the fasting has been written down. And we always write things down when we want to make an emphasis. So if I say to somebody, oh, I'm going to agree with you to buy this or the other, they go, put it in writing. Put it in writing. So Allah subhanahu wa ta'ala says in the Quran, كُتِبَ عَلَيْكُمُ الصِّيَامُ, it's been written down for you that you have to do it. So mashallah, it has become such a part of the Muslim psychology, character, that a person can't imagine, even if they're a bit unwell or something, that they don't fast, which is a very praiseworthy thing. I remember my auntie, she's passed away now, rahmatullah alayha. She was in her late 80s. She would do all the fasts, and she would do all the tarawih, and she would do 20 rakat, and all the way till the end. Because it is part and parcel of a Muslim's personality and identity, that they fast in the month of Ramadan. Even if you ask non-Muslims, they will say, I remember somebody from Manchester where there's a by-election about to happen. It was a non-Muslim lady, and she said she was standing as one of the parties. She said, "Oh, Ramadan is coming, and I look forward to saying Ramadan Mubarak to our Muslim community." Even non-Muslims know about the importance of Ramadan for the Muslim community. Because of all these factors, what happens is that if a person is slightly ill, they kind of put the illness to the side, and then they'll march on into the fasting, and then sometimes problems occur. So one of the things which I wanted to briefly touch on today, because there's so many things we can talk about, is what kind of things will invalidate the fast if you're ill. And one of them is the inhaler usage, because that does have medication within the system of using the inhaler, and it ends up going down the throat, and that will break the fast. Now obviously if a person is ill, they are not required to fast, because Allah subhanahu wa ta'ala mentioned this in the Quran, فَمَنْ كَانَ مَرِيدًا مَنْ كَانَ مِنْكُمْ مَرِيدًا أَوْ عَلَى سَفَرٍ. A person who is ill or on a journey, they can open the fast. Now here I would advise one thing though, which I mention regularly. How do you assess that you should break the fast? On what basis can you end fasting? This is a judgment. that the individual can make using criteria. Number one criteria is, for example, let's use the scenario of the inhaler. Maybe a person has got mild asthma, so they can go through the day not really needing to use the inhaler, and after the fast is open, they can use it before the Taraweeh, for example. So they know they can do this because of, number one, experience. So if they have an experience from last time or previously that they were able to manage the fast with the medication prior to starting the fast or after the fast, use that as a rule of thumb and a guide for you. So that is one scenario, experience. The second scenario is that to take medical advice, so that you get the same knowledge from your experience as you get from the specialist. So you ask the doctor whether the person will be able to manage the fast with the ailment, in this case using the inhaler. And the other scenario is that you can in fact do your own ijtihad and judgment. Maybe you're in a situation where you don't get a chance to ask someone, and you got a fever and you got a flu or whatever, and it's really bad. You can open the fast because of the illness based on your assessment that I can't carry on. So you got three parameters there to make assessment with. And the underlying point there is to get ghalibul dhann, that more likely than not, I'm not going to be able to carry on with the fast. So I can then at that stage, the Quran says, if you're ill, you can open the fast. فَمَنْ كَانَ مِنْكُمْ مَرِيدًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ مِّنْ أَيَّامٍ أُخَرٍ. There are other rules as well, I'll just come to briefly. Another scenario which can invalidate the fast is that someone takes medication, for example, through the back passage. Because what you're not allowed to do when you're fasting is eat something which goes into your stomach. And obviously the stomach and then the exit of the stomach is the back passage. So if you take a suppository, etc., which is medication through the back passage, that will invalidate the fast as well. So there's something to be aware of in terms of medications. And there are other issues as well. For example, Sheikh Mufti Rafi Usmani rahmatullah alayhi, one of my senior teachers, he has done an amazing effort in this regard, discussing, for example, the front passage for the male and the female. If they take medication through that front passage, will that invalidate the fast? In the traditional scholarly discussions, the fast would break if you used any medication in the front passage for the man or the front passage for the lady. However, Sheikh Mufti Rafi Usmani rahmatullah alayhi, he clarified that in light of modern scientific knowledge, we can now clarify with certainty that the front passage for the male and the female is not linked to the stomach, unlike the back passages, and therefore the fast will not invalidate if a person has, for example, a smear test to check for cancer or any other medication that is taken from the front passage. That's number one. Secondly, we would still advise that if you can do these type of tests or medication not at the time of fasting, it's better. But it won't break the fast as per the you could say research of Sheikh Mufti Rafi Usmani, and the references are there as well. Other point to note, people do ask about using patches, smoker's patch or an injection or drip, bathing, will that invalidate the fast or not? In that regard, first point is that whatever enters the throat and the stomach will break the fast. Injection doesn't do that, nor does bathing, and nor does a drip, and nor does smoker's patch. Because it's just like going through the skin. So just like if someone does wudu, it doesn't invalidate the fast. Likewise, bathing or using a drip, etc., injection won't break the fast from an Islamic perspective, because it's not considered as eating and drinking. Eardrops and eye drops, again, these won't break the fast. Only if, for example, the eardrum has been ruptured, maybe some accident happened, etc., and therefore the medication would go right into the back of the throat. So that's why it would break. Eye drops wouldn't break in any case, even if you can taste it, because the pores of the skin, similar is the small pore in the eye, which allows the eye drop to go into the back of the throat. So that's not a normal orifice for eating and drinking. and doesn't go into the throat like the ear. There's a proper channel. And then giving blood, I always clarify this as well. The only issue here is that it can cause a person to become weak, and so therefore it is advisable to, if a person needs to give blood, incidents do happen, then in that situation they should try and do it after the prayer, after the fast is finished. But if they did it while they were fasting, it wouldn't break the fast. So that hopefully is clear as well. And then the diabetes point, I always advise, and Dr. Ateeq is here as well, inshallah, he will mention more on this point, that people need to be able to judge whether the diabetes is severe, or if it's in the initial stage where they can, through diet and exercise, manage the illness. That is something where discussion is required. And you get tips like, for example, if a person is opening the fast, try to avoid carbohydrates, eating a lot of brown foods like bread or chapatis and rice and things, and eat more vegetables and proteins and fish. That is a good piece of advice. Likewise, use vinegar, for example, with the food. One thing is a sunnah of the Prophet sallallahu alaihi wasallam. The hadith of Sahih Muslim mentions ni'mal idamu al-khal, that one of the best condiments is vinegar, and studies indicate that it helps with the blood sugar level. It keeps it more balanced. And there are other questions as well, ladies who are pregnant and the like. If they feel that there is a concern for their own well-being or the child's well-being, for example, if she's breastfeeding, etc., then she can open the fast in those situations as well. And there are other more rare occasions, but still occur, where a person is maybe in a particular job which is very, technically, requires precision, like a surgeon or someone who is a pilot, and there are, one slight mistake, etc., will cause big problem, especially if it's a long flight or they got a long session for the surgery. Then we would advise that in that situation a person can be excused, but they should refer to a Mufti to get advice on their particular situation. So it's on a case-by-case basis. Okay, I don't want to mention too many other points, because I know Dr. Ateeq wanted to mention, he in fact said that we can take questions from people who are present. Previous sessions we've had, there have been good questions which people wanted to ask, practical issues which arise in the community, and we can deal with them, inshallah. So I think if Dr. Ateeq, if you want to mention a few points, and then we can take questions, inshallah.
Assalamu alaikum wa rahmatullahi wa barakatuh. Like Mufti Saab mentioned, I'll briefly go through the medical aspects. So to start, just create a hypothetical patient, and then we'll discuss. The more we have interactive, rather than being didactic, I think if an interactive discussion will be better. So it will benefit not only the individual who's asking the question, but also the wider audience. So we've got a 65-year-old gentleman who has got type 2 diabetes, hypertension, heart problem, high cholesterol. So on various medications for diabetes, he takes metformin and insulin twice daily. He also takes antihypertensive for his blood pressure, blood thinning tablet, and cholesterol lowering tablet. So he comes in for a checkup and says, I want to fast. So what advice we will give? So this is general concepts in terms of the patients coming to us. So the first and foremost recommendation is, as we grow older, the organ is the presentation where? Sorry, what is that? That's fine, doesn't matter. I think it's okay, presentation. As we grow older, the organs also are growing older. So especially after 40 years plus, every other individual will suffer from one of these with problems. Diabetes is 6 times more common in the Asian population compared to Caucasians. Yeah. There are various factors about it. I've not dwell on the reasons for it. And high blood pressure, heart problem. These are very common. Just last week, we had a young patient who had a heart attack in his 20s. We had a stroke in his 40s, all from the local neighborhood. So we see on the daily basis. So like Mufti Sahib mentioned, generally we fast from the age of 6, 7, especially the younger ones. So to leave the fast is very emotionally difficult as we grow older with conditions. But then generally there is a consensus to what do you do? What are the risks versus benefits of fasting? So take for diabetes, for example. The common condition is type 2 diabetes, which is managed with tablets or diet tablets or plus or minus insulin. So there are three categories in this. One is diabetes who can manage on diet alone. They are the least risk category, so they should be fasting without any problems. Actually, fasting is beneficial for them. They'll do better. Then there are those people who have to go on tablets. Again, majority of the tablets do not drop the blood sugars, apart from one tablet called sulfonylurea. It's called gliclazide as commonly, or glibenclamide generally. People who take that medication will be. That tablet drops the blood sugars. So what do you do when you are on that medications? And the third category is medications plus insulin. They can be on 1 daily insulin, twice daily insulin, or 4 times daily insulin. So the challenges comes when you have medication which drops the blood sugars, either through medication, tablets or insulin. And for this, you really have to plan ahead. So this talk should have actually been 2 weeks before. For me to change my lifestyle, to change my medication and to have expert advice from my health professional, I need time to it. Because suddenly in 2 days time you've got Ramadan, and if I'm on insulin, if I want to change it today, there will be permutations once you're fasting and suddenly your blood sugars can be high or low. What do you do with that? So that's the reason why it's always recommended that whatever we do, if we have got chronic conditions which require change in medication, we make an appointment with the healthcare professional at least 3 to 4 weeks in advance. They will look at your physical condition. They'll look at a recent blood test, including your kidney function and making sure they are all fine. They'll also go through your previous experience, like Mufti Sahib mentioned. When I fasted last Ramadan, did I go into any problems? Did the medication be changed? Or did there was any modifications in my lifestyle? So that will be taken in. And then the individual or the health professional will give you advice. Did you get me? So in tablets, when I mentioned it's not a problem, which majority of the tablets not a problem. When you are on gliclazide, which drops your blood sugar, then if your blood sugar is tight controlled, there is a possibility that you might have to drop the morning dose at sahur time, or at least reduce it by 50%. Again, this will be guided by measuring or monitoring your blood sugar on a regular basis. And if you're on insulin, again it is possible that if you're on once daily insulin and one is taken in the morning, move that into the evening after iftar. Straightforward, no problems. But if you're twice daily insulin, one you take at morning sahur time, one at iftar time, what do? It is possible that you might have to cut down the morning insulin by 20%, 30%, 50%, depending on your blood sugar. So the key here is monitoring. And like Mufti Sahib mentioned, just by checking the blood sugars doesn't invalidate your fast. If you want to fast and you're on a medication that reduces blood sugar, it is important that we monitor the blood sugars. Because especially this is the fine now that fasts are getting shorter and shorter. But going back 3-4 years when it was June, July, it was a challenge. I had mentioned it before. I had an elder, a big scholar from a different country. He came in here. He normally comes every Ramadan. I got a call at 5 o'clock in the evening, as Asr was around 6:30, saying his blood sugar has dropped to 4.2. What do? He's on insulin. And he's just given a talk, and it's Asr time. And it's 4.2. And it's very difficult to ask him to break the fast at that time. He's already taken his insulin. He's stable at the present moment. So I asked him to just don't move a muscle. I made him lie down, rest, and monitor his blood sugars every 30 minutes. So these things do come. So that's the reason why I think having a health check 4 to 6 weeks is very important. On the other hand, if you've got diabetes with complication, severe eye disease, severe kidney disease, your kidney function are low, you've got a heart condition with the pumping action very low, and in these circumstances, the chances are that you are at a high risk of developing problems during fasting. And it might be that you might have to stop fasting or you not fast on that time. So this is where individual circumstances from a previous experience, and then taking advice from the medical professionals. Ideally, you should be a Muslim practicing doctor, that's better, but in some circumstances you might not get it. And then taking advice from the religious scholar. all put together, you make a decision. Now just touching on diet generally, I think the majority of us, we have a certain diet, or from culturally or from a background, or an ethnic background. And most of a South Asian diet is a high carb diet. One of the reasons among many reasons that why people with type 2 diabetes are more prevalent in South Asian population, ours is a high carbogenic diet. Our carb is too high. We look at keep a food diary and look at our breakfast, look at our lunch, look at our dinner. And in between we graze as well. And generally we graze the wrong things. So automatically our blood sugars are high. And the calories we take in, we don't burn them. Our physical activity is limited. There was a study looking at the physical activity among Caucasians compared to Asians. And guess what the results was? So the Caucasians physically were more active than us. Even among us, Pakistanis, Indians, Bangladeshis, we divided them, we were less and less and less. So physically we are inactive. So this not only pushes the incidence of type 2 diabetes, also pushes the incidence of obesity, our weight gain. Every second or third individual is obese or overweight. Yeah. So again, Ramadan is a good opportunity for us to lose weight. There was a study in Pakistan a few years ago looking at the weight for people who had fasted. So they looked at certain individuals, or probably 100 or 200 people, measured the weight before Ramadan and measured the weight after Ramadan. And guess what the results was? Majority of them weight had gone up. Yeah. One is the barakah of obviously from Allah subhanahu wa ta'ala in our rizq. But we take that in a wrong. We eat at suhoor. We break a fast in the masjid at iftar. We go home and eat. And mashallah, Tarawih is going to finish very early at 9:30. We still got time before we go to bed, we have another meal. The worst thing one person can do, especially even for people who do not fast, is eating late at night. Your liver doesn't have time to detoxify, and your blood sugars are obviously high for all the while, the whole of the night. That gradually you accumulate the calories, develop resistance to insulin action, and your weight goes up. So they're very, very important that I think we look at a diet, as Mufti mentioned, complex carbohydrates rather than high carbs. And the second thing which we do is our portion size is high. If you look at the simple plate we have, 90% is carbs. Among the 10-20%, reluctantly we take some vegetables and some fruits. But if you look at the Caucasian, the white man's plate, it's the other way. So the rule of thumb you have to, if you want to change our diet, when you sit on the dastarkhan, start to eat all the healthy stuff first. The more healthy stuff I eat, the less space I have in the stomach to eat the unhealthy stuff. No matter what we have left, if I eat the healthy stuff first, all your greens first, all your fruits first, all your proteins first, and then what's left behind, even if you want to taste a samosa, doesn't matter, because you don't have the space of more than one actually. On the other hand, if you start with samosas and pakoras, then 90% of your stomach is filled with the wrong stuff. Then you won't touch the right stuff. So this is one way of eating it. Portion size and the right stuff. This will obviously help us. And the third opportunity what we have in terms of smoking. Smoking is very prevalent in our societies. Yeah. One is smoking, I won't say it's haram, I think Mufti Sahib will mention it. Waste of money. It's a bad habit. It affects majority of our organs of the body. Smoking kills more people with lung cancer than some of the like road traffic accidents or apart from the other cancers. It's very, very high. So Ramadan is a good opportunity for us to stop smoking. And majority of the chronic smokers, they do fast. So they're able to manage without smoking for 12-14 hours. So if you can stop smoking for 12-14 hours, why can't we stop altogether? It will help us. It's a golden option in Ramadan to stop smoking. Okay? And there are other three, four common illnesses which we have, which we affect because of Ramadan. Headaches, especially migraine sufferers will notice when it comes to Ramadan, they suffer, especially the first few days. Because fasting can be a trigger, hunger and lack of sleep can be a trigger for migraines. So depending on the medication you take in terms of preventive, it's always good to take preventative medication the first few days till your body gets acclimatized to fasting. Second is because of dehydration, you get headaches. We don't drink enough fluids. So ideally try to drink enough fluids both at suhoor time and iftar time. compensate that after iftar time to prevent headaches. Second common problem which we get is acidity, reflux problems in Ramadan. Because obviously empty stomach, you have more of acidity in your stomach as well. And then when you start eating all the fried foods in the evening, and then obviously sleeping with a full stomach, you get reflux problem. So best is to cut down the portion size, avoid fried foods and fizzy drinks, and use liberal amount of yogurts in your diet. Yogurt is pretty good. So this will help to, in terms of coat your gut, your bowel things, and help you to reduce the reflux problem. And then if you need medication like your ranitidine or PPI medications or the Gaviscon, you can use that. And the other thing which is commonly experienced is constipation. Again, we don't drink enough of fluids and not enough of fiber in our diet. These two can compound the problems. So if we look at these small things, that will help us, inshallah. And by observing the fast medically as we're supposed to do, we will lose weight. Once you start losing weight, if your diabetes is high, that will help you with diabetes. It will help with your blood pressure. It will help with your cholesterol. Okay? And if you start losing weight, it will help your arthritis will come down. Other illness which is associated with obesity will come down. So it is all to gain for, nothing to lose by fasting. And today the biggest part is intermittent fasting, 5-2 fasting, calorie-restricted fasting. All these have been taken. And Allah subhanahu wa ta'ala has given us from the earlier times to fast. And if you fast well, inshallah, not only it will benefit spiritually, but it will benefit physically as well, inshallah. With that, I think we'll open this to questions, so that depending on any specific questions, we can take it from there.
If somebody is taking metformin for diabetes, 500 milligrams in the morning, 500 in the evening, can we do the same in Ramadan? Taking 500 is sahur and 500 is sahur?
Shouldn't be a problem also. Shouldn't be a problem. It depends also on your HbA1c as well. But because metformin doesn't really drop your blood sugars, so it should be fine. When you're on metformin, we normally don't recommend it all. Okay, but if you've got a blood sugar meter, I would just check it at 5 just before Asr. You will know your blood sugars. But generally, metformin is fine. There's tablets called SGLT2 inhibitor. They're also fine. Okay. If you obviously with the dapagliflozin, empagliflozin, normally if you're taking it suhoor, because it works in your kidneys and drives, it basically you start to break down your sugar. Sugar is passed in your waters. We recommend that you take it at iftar time. So iftar, you break your fast 5:30. By the time you go to bed, it's 10 o'clock. So that will help you because you obviously want to compensate by drinking. So that's one thing you can move from suhoor to iftar. Rest of the medications, the glycoside, I would recommend that to be on the safer side, if you haven't taken advice, if you're taking one in the morning, one in the evening, I would cut down, either omit the suhoor time or half the medication. And the best time to do all these things is during the Shaban. In the Shaban period, you have time to alter your medication, modify your lifestyle, especially if somebody is on insulin, change your life, and monitor your blood sugar, because at that time if something goes wrong, you can break the fast and you don't feel the guilt, because if it's enough, you'll fast. So at least by day 1 Ramadan, you know exactly what medication you take, how much of insulin, what dose you take, so that will help you to have a peace of mind and you fast through the month of Ramadan. So preparation is important. Like somebody who's used to 8 or 10 cups of coffee, suddenly he doesn't come on day 1 on Ramadan and stop the coffee like that. He knows that in 12 days or 15 days, I will obviously have to stop coffee. So he'll gradually wean off his coffee day by day. He'll drop it to 6 cups, then 4 cups, 2 cups, 1 cup, he knows. And the day 1, he'll go have just 1 cup of coffee. Similarly with medical problems, you have to plan 2 weeks in advance. If I've got chronic problems, which I have to take medication and insulin irrespective, so I have to plan and make sure you make the changes well in advance. So on the day 1 Ramadan, I'm confident that Alhamdulillah, I've done all my bit and I'm sure there shouldn't be a problem. Is it dapagliflozin, empagliflozin, glycoside? Yeah, that is the one which drops your blood sugars. It's not an issue. It depends on what your blood sugars are, how much are you taking. There can be 1 tablet, 2 tablets in the morning, 2 in the evening. Okay. So what I would recommend in the next couple of days' time, try to fast and just check your blood sugars. What is your last HbA1c is what I would say. Blood test? Did you not do blood test in the last 3 months, 4 months, 6 months? Yeah, in the last 6 months, what was your HbA1c? 9 is pretty high. So the chances are your blood sugars are high. Okay. So there is most likely chance that if you are not monitoring, because when you are on glycoside, you have to monitor your blood sugar. So what I would recommend is, you've got 3-4 days left, whilst on the glycoside, fast and see what happens to your blood sugars at 12 noon and 5 p.m. If your blood sugar has been stable, you know that you probably have to take it. If your blood sugars start to drop, it's very tight, 4-5 in the daytime, then cut down to half. But still, if your HbA1c is 9%, that's poor control. You probably require some other medication. So this is what I said in terms of planning. Khair, inshallah. So it might be that you will not have a problem. But I would probably repeat your bloods after Ramadan and get it. See, if your blood sugar is slightly high, say 10, 12 for the month of Ramadan, it's not a big deal in the larger scheme of things, inshallah, because you won't get any symptoms. But generally speaking, longer time, if you leave your HbA1c is high, it will start damaging your internal organs. So for that, I think tighter control better, maybe. But it's probably monitoring your blood sugars whilst on the medication is important. At least 3-4 times. Yeah, in the first few days.
I have a question from Mufti. Obviously, you will be related with this. What is the maximum illness or a problem by which you can use the fast? And if you are already fasting, the same thing, what maximum can make you break your fast?
Okay, Bismillah ar-Rahman ar-Rahim. It's a good question. People oftentimes have to deal with this situation where they maybe are ill and they're fasting and they don't know whether they should open the fast. So this is one of those situations where this does require judgment. And that judgment is based on what I mentioned about 20 minutes ago. Ghalibul dhan. Ghalibul dhan means that more likely than not, if you carry on with the fast, it's going to cause you harm. Is it going to cause you harm? Like for example, a brother who's got diabetes, and imagine it's more severe, and if they carry on, and Dr. Saab indicated previously, was another Maulana in a mosque, and he was on a certain level of blood sugars, and which is going to maybe go down, it's going to harm them. Then that is time you have to open the fast, because it's not allowed Islamically to harm yourself. And this is something which is, like we say about suicide is haram, harming yourself is haram as well. So you should always be careful that if you're ill, assess whether this is going to harm your health and make it worse. If it is, then you should open the fast. So this is a judgment. You can use what I mentioned, previous experience. Like somebody can say, oh, I've got a really bad headache, but by the afternoon maybe I'll sleep a little bit and go away. Somebody else knows that this is the beginning of a big migraine, and then it can, health will deteriorate from previous experience. They open the fast. Likewise, the mother who is breastfeeding, etc., she feels that she can't cope or manage with the situation. She makes the judgment herself, it's going to harm her or her child, not based on any mathematical formula, but based on the judgment of the person, that more likely than not, this will cause me or my child harm. They will then open the fast. There's scope for them to open the fast. But obviously, you should get advice from a medical doctor on that as well. Because this is, again, it helps you get your ghalibul dhan, or like what will more likely than not happen. So when Dr. Saab says, oh, you're on, for blood sugars, you're on level 9, okay, that's a borderline. So he's not saying don't fast, and he's not saying fast, it's like borderline. And then the brother mentioned, okay, I fasted like this last year and there was no problem. So this is a proof for him that they can go ahead and fast. But if a problem occurred, maybe some issues have, inshallah, it won't happen. But then they'll say, right, I had to stop my fasts last year. So in the next year, he will say, look, you know what, I did it last time and I had to stop, for this reason. So you can use that as a benchmark to help you as well. Previous experience, your own judgment, and then medical advice. This will help you make your decision, inshallah. I just wanted to touch on what Dr. Sahab was talking about in terms of smoking. Obviously, smoking firstly breaks the fast. Islamically, like the inhaler situation, anything enters the throat which has got particles, smoke particles, etc., and then the inhaler medication particles, that will break the fast. However, the issue of smoking itself, ulama usually in the past, they would say it's makruh, disliked. The reason they were not happy, they were not happy with people smoking, but they said makruh in the traditional text, because at that time they didn't have the scientific knowledge and understanding to see that the smoke which a person is inhaling is going to cause them lung cancer, throat cancer, and all other sorts of problems for breathing and ill health. Now that medical advice is clear, like emphysema and all these type of illnesses occur. So now the situation is more prohibitive. Previously, makruh means you shouldn't do it. Now it's like not permitted to harm yourself. You know what I mentioned about is you're not allowed to harm yourself. Smoking is harming yourself. Slowly, it builds up the harm until you get ill. That slow build up of in the lungs, back of the throat, causing cancer and things like that. It happens slowly. So this is why you need to avoid it in Ramadan and outside Ramadan. If other people are smoking, it can happen. You're like maybe in a lift, maybe in a taxi or a bus. Just avoid as much as you can, to see anything harm. Inshallah, it shouldn't be a problem because I wouldn't, inshallah, break the fast in the sense that it's more like, when somebody is smoking themselves, it's directly going in. Whereas if it's more like air, like fragrance of flower or something like this, that doesn't break it. But when you person is smoking, it's going direct, thick smoke, which is going to break it. Similar with the exhaust fumes, that wouldn't break it in the sense that it's because it's like the air. But when you're smoking, it's very concentrated and this goes into the throat. Okay, yep.
This goes to the inhalants. I think that's still, I don't know if it's 100% like you said, it's completely, but I've heard from other scholars who say it can be used because it's not creating food particles that you're using, it goes through the airway.
Yeah, so this I do discuss normally in the slides when there's a bit more time, where the inhaler you get different types. So certain types you have like a fluid which is turned into like a vapor and it goes into the throat and like you say you breathe it in. And so the point here is the fact that a person is using the inhaler to get medication into the body. So when that's the case, then normally what happens is the drops of liquid, like water drops as well, they will end up getting to the back of the throat and dripping into the gullet where the food goes as well. And then obviously the medication goes into the lungs. So the lungs is the issue is if it goes down the throat, that will be sufficient to break the fast. And when the liquid gathers at the back of the throat, it will go into the throat, down the throat. The food pipe, it will go down that as well. So that's why we say that if you need to take, use the inhaler and the medication, then you're not required to fast. And my advice was that if you can do it before the fast and after the fast, excellent. And test it during the day. If you don't need it, then excellent. But if you do need it, you can break the fast. You tried your best. So this is getting experience. Yep, this question. So this is a judgment as well. if you know that, look, by midday my blood sugar, for example, will go down and I have to open the fast, then the person is exempt from starting the fast because they are excused. Man kana minkum maridan, you're ill. Dr. Saab has been talking about this illness for the last 20 minutes. So you're definitely ill. You have that dispensation not to fast. If you know, for example, what happened the day before, so you've got experience of that as well. And I use experience as your rule of thumb. Like the brother, mashallah, said, last year I was ill. I had this similar type of diabetes. I was okay with the fast. That's your proof. Ghalibud dhan, more likely than not, nothing will happen, inshallah.
So harming yourself is
It's not.
So if someone is not that much ill that it can harm him that much. At that point, should he have to prevent fasting, or he can try?
So if it is a borderline case, this is where, what the brother did today, ask for advice. And then take that medical advice to get more clarity where there's a grey area. Illness can be like this, a person is having diabetes, getting worse slowly. Or some other illness, slowly is getting worse. So then this is where medical advice will help you make an informed decision. So you go to the doctor and say, look, and Dr. Sahib is right, go to a Muslim doctor, practicing Muslim doctor, and say that, look, put your position in front of them and get their advice. Because, like brother was saying, we don't want anyone to harm themselves. This is not the Islamic thing to do. That you do the fast where Allah has given you the rukhsa, the dispensation not to fast for a reason. That's why I cited it at the beginning, where Allah subhanahu wa ta'ala mentions straight after Kutiba alaykum as-siyam, He says, فَمَنْ كَانَ مِنْكُمْ مَرِيضًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ مِّنْ أَيَّامٍ أُخْرَ. You've got dispensation for fasting, to not fast if you're ill. And that's for a reason, because Allah subhanahu wa ta'ala does not want you to harm yourself. So we shouldn't want to harm ourselves as well.
This is the problem from the point of view. I think we can go to any doctor, even if they're not.
Yes. Yep.
They won't give you the Islamic fatwa from the people say, now you can train if the fasting month is coming fasting.
Yeah, I 100% agree. It's better if there's a Muslim doctor, but it's not required. Not at all. Because the aim is ghalibud dhan. More likely than not, what will happen to you? Will you harm yourself, or are you okay? So this doesn't require a Muslim doctor, but it's better because they will be able to appreciate your sentiment with regards to the importance of fasting. But in terms of harming yourself, as long as you have expert opinion, this is the objective of going to the doctor.
Just to add, Maulana, questions about illnesses. When you go to a doctor and say that I want to fast, the one question he will obviously have is, does fasting worsen your illness? If he thinks or she thinks that the fasting will worsen your illness, then they'll recommend not to fast.
Okay, related to the same question, if his condition remains same throughout the whole year, then should he, what will he do then?
I think the best thing is, as I mentioned, do a nafil fast and see your experience, what you would have had. Shaban mein karo, Rajab mein karo. So usme bhi, what I normally do is basically, if you feel that fasting for whole 14 hours, if you want to see how your condition is, the first day fast for 6 hours and see what your condition is. Next day you do it for 8 hours. Third day you do for 10 hours. If you have survived and you have no problem fasting in the other months, then you know that you're confident that you can manage in Ramadan. So that is where your trial period is, training period. Yes.
Muslim family is coming from background where we came from, we were told you have to fast till that time that you are able to know where is the sky and so we were told you can't.
See, so this is a good point. This is a misconception where people think that illness has to be like you're completely knocked out and you physically cannot completely at all fast. That's not the case. The issue is in Islamic law that you don't harm yourself. And you know, there are many laws like this, not just fasting. For example, somebody is doing wudu and the water will make them ill or will make them recovery time is even longer, they can do tayammum. On the same point, you're not allowed to harm yourself, including making yourself more ill. So as long as you have that principle in mind, you can get advice and use your experience to come to informed decision, inshallah. Go on. Sallallahu Alaihi Wasallam. 100%. But there are some people, this is a good point, fasting, even non-Muslims do fasting now for health purposes, and subhanallah, they say fast twice a week. And some of them even said Monday and Thursday to spread it out, which is the exact of the sunnah. So this is important point which doctors have alluded to as well. That if someone has mild diabetes, fasting helps them because they're cutting out the carbohydrates completely, because they're cutting out all the food. But obviously there are issues then if it's serious level of diabetes, then there's problems. I'll take a question. Go on. Yeah. Can't fast. So this is get medical advice that what is the likelihood if a person has got a lifelong illness, they know that they're not going to get better. So this is where the Quranic rule regarding fidya will apply, that for the fasting time, because you're not going to be able to do qada later, so then you pay the fidya, which is the same amount that we have Eid al-Fitr. So for each day you're not able to fast, you pay that fidya. But that is again a judgment, ideally through a medical profession, person who can advise you that look, you're not able to fast now because of your diabetes is so extreme, and obviously it's not going to really improve as you go further in life. So you know that you're not going to be able to do qada, you're not going to do ada, fulfill and discharge the obligation of fasting, and you're not going to be able to do qada. So then you have to do the fidya, which is the amount which I mentioned on Eid al-Fitr, which is paid. The other thing I would say is that if a person can't fast, it has a spiritual impact on a person to fast in Ramadan. It strengthens you, because the Quran mentions لَعَلَّكُمْ تَتَّقُونَ, that it gives you taqwa. And I'll mention something which Imam Ghazali referred to, and everyone can act on this, which he said that the fast is of 3 levels. Level 1 is about fulfilling Allah's command regarding not eating, drinking and marital relations and the like. So to avoid that is the basic level everybody has to do. Then the next level of fast is, we're talking about spirituality here. So he says the next level is that you don't say or do anything which is haram. So in the period of the Ramadan, you're not eating and drinking. This is a law Allah has said. But He said other laws as well. Not to backbite, not to use foul language, not verbally and not on WhatsApp and not on anything else. To try to avoid that. So this is the second level. First, on the, you could say, bodily level. The second, in terms of the spiritual level, is doing any action, amal, speech or action which is un-Islamic. The third level, now we're going to the, you could say, the hardest one, which is of the thoughts as well. That if anyone has any bad thought, that they will not entertain it, they will dismiss it. So this is like the higher level, that you can do these 3 levels: the bodily level, the speech and then the action, and then even the thoughts that what are going through your mind. If they are bad thoughts, you don't accept them, you reject them. So if a person is ill and they can't fast at the bodily level, they should still be able to do the other 2 levels. That you avoid the wrong action, especially in Ramadan, obviously all year round. But likewise, also any bad thoughts that come to your mind, you reject them as well. So even if a person can't do the bodily one, they can do the other two spiritual level, injunctions which are to be followed. So that helps, inshallah, a person who can't fast. There comes a time and an age where a person is difficult to them fast and then they can't fast. So you can do these two other levels of the spiritual fast. And also I always advise that, like we have the phone, every year somebody is trying to get an upgrade. So we should, if we are happy to have that for the phone, we should be happy to have that for the fast. That this year's fast will be upgrade. From last year's, 2025 version, we want 2026 version far better than last year. So we aim for that spiritual level of the fast, actions, the speech, and then even the thoughts, that we monitor them as well. Just like we monitor the blood sugar, we monitor these things as well. And inshallah, that way you have the upgrade in the fasting as well, inshallah. And that can be done, again, even if you're ill, inshallah.
Short question. About miswak, toothpaste.
Okay.
And secondly, sleeping for a long time during fasting is not advised. It's not liked. If someone is working during the night, then he can sleep obviously during the day.
See, the thing with first question was on toothpaste and miswak. Miswak, like wudu, like a person can use wudu water to gargle, that's not a problem. Islamically, you need to do wudu, you need to gargle, likewise use the miswak. Even if there is a taste on the miswak, you can have taste in water. Like, Birmingham City Council water here tastes different to the one in London, which is different to the one in Manchester. So the water has taste. Taste doesn't, as long as nothing goes down the throat, everything comes out. It wouldn't break the fast to use the miswak. But our advice generally is to avoid makruh for the toothpaste and the toothbrush because it could go down the throat. That's why there is a dislike for it. But if there was a need, like for example, I don't know, somebody had a meeting or interview, say with non-Muslim, etc., and there was a need here not to have a negative impression for that person, then what you can do is the toothbrush or something with person leaning forward to ensure nothing goes down the throat. But if it did, it would still invalidate the fast. Okay, and the other point was the sleeping thing is according to need. Person is working night shifts or even early in the morning they are working. It's a sunnah of the Prophet ﷺ to sleep in the afternoon, kaylula. And I think, according to the need of the person, older people need more sleep sometimes in the afternoon, potentially, and it will help them fast. So I think this shouldn't be a problem to sleep. But obviously, these are the days where you want them to count for you in the akhirah. And this is why, you could say sunnah of the companions, they would all make extra effort of the salaf. They would make extra effort in qira'atul Qur'an. This is, Shahru Ramadan unzila fihi al-Qur'an. So this is our opportunity to recite the Qur'an, and they would finish the Qur'an many times in the month. From the time of the salaf. So I would say sleeping a bit less is a good thing in this month, to try to do the tahajjud as much as you can, and likewise recitation of the Qur'an. And I always give this example, that the impact of the Qur'an. If I was to talk to you today about some chocolate cake, and the cream, and he had all these different layers of cream, etc. If I kept on talking like that, eventually you'd start having saliva in the mouth. So my words are having an impact on you physically, chemically. So you think Allah's words will not have an impact on you? 100% it will have an impact on you. So this is why we emphasize recitation of Quran, and is Allah's speech, and it will transform you if you can understand it. Try to read the translation if possible. But even qira'ah of it has a powerful impact as well. And even listening to it is good as well, because the Prophet of Allah sallallahu alaihi wasallam, he asked one of the companions, I think it was Ibn Masud, Abdullah ibn Masud radiallahu anhu, to recite the Quran. And Abdullah ibn Masud radiallahu anhu was surprised. He said that, the Quran was revealed to you, Ya Rasulullah. And he said, I wanted to hear it. So even listening to the Quran is a virtuous thing to do. Like somebody is driving the car, they are walking, you can have it on your phone, etc. Utilize it. I remember my teacher, Sheikh Mufti Taqi Uthmani, I'll conclude on this, using time. I remember we came to see him, he was in a hotel, and he said, let's go to the other room, because they had another room available, so we can sit and talk there. And I would say it was about 20 rooms down the corridor. Soon as he came out the room, he had a phone like this, and he went straight, opened it up, and I could see from there, it was in black and white, Quran. And he recited the Quran all the way to that 15, 20 rooms down the corridor. Then he got there, and they put the phone away. He was not prepared to waste, I would say, about 40 seconds to a minute walk. He was not prepared to let that go without reciting Quran. And this was outside the month of Ramadan. So you can use that as an example of how to use your time in the car, walking out and about, etc., listening to Quran, etc., and reading Quran as much as you can. So this will help you mentally prepare yourself, inshallah. Okay, very last question, inshallah. Chale.
After Qaza al-Haja, what's the limit of washing? As you have mentioned before, that the back part is related with the...
Washing is a good question for the front passage and the back passage. The cleaning of a person is also based on ghalibul dhan. Ghalibul dhan is that more likely than not, you have attained cleanliness. On the back passage and the front passage, and nothing will come out, is sufficient. Ghalibul dhan means more likely than not. This happens in many, many scenarios. Even, for example, someone's stopped off at a service station and they want to find the Qibla, they don't have a compass, they can use stars, etc., sunset, what happened, to gain ghalibul dhan, that this is the direction of Qibla, and then they can pray their salah. And that's accepted from them. And in the Hanafi school, even if somebody later on, he's prayed and he's about to drive off, somebody goes, oh brother, you made a mistake. It was in that direction. In the Hanafi school, you did what you could, and so your prayer is valid and you don't need to repeat it even. So ghalibul dhan, more likely than not, if you are sure that you cleaned yourself from the back and the front, you don't need to do more than that. And likewise for the fasting, the person to judge whether they can manage the fast or not, they can go with that same assessment, ghalibul dhan, for that purpose as well, inshallah. Wa sallallahu ta'ala ala khairi khalqihi Muhammadin wa ala alihi wa sahbihi ajma'in.